All right, it's Dr. Brett here, and I am going to cover just a little bit of something here that's just been on my head since yesterday. I actually have one of my daughters in here right now, and she was in here along with my older daughter when I had a patient come in, and he was a train wreck. He could barely get on the table, complained a lot about how he felt, and was really like in a bad spot where my daughters, 5 and 7-year-olds, recognized that, and they're like, why was he so bad when he came in here? And they saw him suffering. They saw him in a pretty crappy spot. And here's the thing is that he was in that spot because of the fact that he did not do anything proactively to help himself out prior to this. He was early 50s on there, quote unquote, never had a problem before, a little bit of stuff here and there, but nothing significant ever before. He questioned how he got to that spot. And I explained to him, like, this didn't happen overnight. It's just the straw that broke the camel's back. You had degenerative things going on. You had poor mechanics going on that have happened over the last 3 or 4 decades of his life on there. My point is this, is that I want to see you prior to you having the wheels fall off the bus completely. I mean, that's a really, really critical thing to understand, because when the wheels fall off the bus, it's really hard for us to help get them back on and avoid permanent damage that you've probably created at that point already. Most people who come in here with a 7 out of 8 or 7 out of 10 pain scale on stuff typically have already created permanent damage to some degree. I have people that come in here with a 3 out of 10 at the age of 35 that already created permanent damage to some degree. I don't want you to end up in a surgeon's office. I don't want you to be on Advil the rest of your life. I don't want you to be on steroids the rest of your life. I do not want you incapacitated at 40 years old, 50 years old, 60 years old, 70 years old, even at that point in time. I want you to be functional. To be alive and not functional is suffering. It's miserable at that point. That's our job here. That's what drives us here. That's what gives us purpose behind what we do. And it also tells me that I need to be very straight with you. I need to be very straight with people that come in here to say, you know what, here's the truth behind what's going on. I'm not going to sugarcoat it. If I do that, I'm not serving you in the way I best possibly could on there. So understand that. The other thing I would say is that if you have friends or family members that you can just tell things just aren't quite right with their body, or even kids that, again, they're busy, they're active, they fall, they have sports, they have random different things that take place with them, get them checked, get the problem resolved when you're young, when you don't have damage. It's really easy, it's really short term, it's really simple, it's really cost effective as well too. And that's the most critical thing to understand here, is that when you have those things, when you take proactive approaches to this, we don't have the big pitfalls later on down the road on there. An ounce of prevention is worth a pound of cure, is the whole idea behind it. And that's where I want you to be. That's what drives us at Delta Health, is not to be a reactionary clinic, but to be a proactive clinic, to be a lifestyle-based clinic. Because yes, I want to be involved in your life. I want our clinic to be involved in your life forever, to some degree. It may be a minimal amount, but you're still involved in our practice because you are taking proactive steps not to let yourself get stuck in a spot that you can't get out of. I see it way too many times. I see people suffering that should not suffer at a very young age. If you've got relatives that have gone through that, you know what I'm talking about. I don't want it to be you. That's why we do what we do. Get your butt in gear and figure it out, period.